How are we doing today? Yeah, I'm really sorry about the wait times. It gets hectic at this time of night, but I'm here now, and we'll get you seen to what. Well, I was gonna say what is the issue, but I can see here that you've done a little bit of damage to the side of your head. Doesn't look too severe, but it's a bit of a nasty cut. That we'll get that seen to and cleaned up. All right. Yeah. So before we get to treating that, I am going to ask you some questions, go over your medical records, make sure they're up to date, and then I am going to check your vital signs. So that's everything like your blood pressure, your heart rate, a little bit about your lungs, your breathing, respiratory system, all the signs of life. And because it's a head injury, I'll do a few cognitive tests with you just to make sure that you're not suffering from any negative symptoms because of the head injury, any concussion, anything like that. But providing that all checks out, I will chuck on a pair of gloves, do a quick exam of the area, go over it, make sure there's nothing still in there, clean it up, and put a dressing on it, okay? So if you don't mind, we could just start with some questions, okay? Nothing too invasive, but just try and answer it as accurately as you can, alright? So we've got your name, date of birth, insurance number, yada yada. Already sorted. Have you recently moved address in the time since your last appointment? Same address, good. Are you allergic to any medications? Oh, good. Any further allergies? Nuts, latex. That's an important one as we do use latex gloves, so good, no latex allergies, fantastic. Alright, prior to the incident, were you on any medication? Nope, good, that's good. And since feeling unwell, have you been taking anything? That's just over the counter, yeah, okay. Just paracetamol, fine. Rough idea about the dosages. And maybe twice a day? Okay, good, that's fine. Try not to exceed about 800 milligrams spread over 24 hours. Aim for less, really, but... Alright, so how long has it been since you started noticing the symptoms? You started feeling unwell, basically? Okay. Alright, and the next questions are just about the symptoms, so yes or no, if you have or are experiencing any of the following. They might not all seem relevant, but just give your best answer, okay? Alright. Have you experienced nausea? Vomiting? Noticed any changes in appetite? Okay, a little bit. Any double or blurred vision? So subtly, maybe. Any increase in drowsiness? Obviously beyond what you would normally expect in an average day. Okay. Any sort of really noticeable fatigue or exhaustion? Again, this is kind of above what you would consider a baseline. Dry mouth, any excess dryness in the mouth? Shortness of breath? Alright, and feeling sort of hot or clammy, maybe a raised temperature, anything along those lines? Alright, and any nosebleeds or blood coming from anywhere that it shouldn't be? Okay. last question on this. On a scale of 1 to 10, so 10 being unbearable, obviously 1 being extremely mild, how severely would you rate your current level of pain, discomfort? Okay, so there's a fluctuation there. Daytime. Right, and let's say evening at its most severe. Okay. That seems fair enough. Alrighty. Now, just before we begin the physical portion, I just need to pop some gloves on, alright? And then we'll briefly start by listening to your breathing, okay? Okay, lovely. So I'm just going to start off by listening to your lungs, alright? If you could just undo the top button, nothing invasive. I'm just going to pop this just down the top of your shirt, okay? Following that, I'm going to give you some instructions, alright? Alright, ready? Okay, I'm just going to place this here. Feel okay? Good. Okay, that's good. Just keep that breathing pattern going if you can. And over here. Really try and fully fill the lungs every time you breathe in, okay? That's good. Very good. Okay, now this time, if you could just, and then hold it. Hold it. Just that. And exhale, very good. Same again, just here. Big deep breath in. Just hold it there. Just holding it there. And relax. Okay, this time if you could fill your lungs and then just give a little cough. Just to okay, ready? So big deep breath in. And just a little cough. And again. One more time. One more time. Good. Okay. That all sounds good. We're just going to do the same, but from the back now. Okay, so if you just swivel in the chair, I'm going to, again, just pop this down the back of your shirt. I apologize for the slight coolness of the end. Feel okay? Alright, good. And just normal, slow breathing, okay? Big deep breath in. Really expand your lungs and then exhale. Good. And same again down here. Really expanding your lungs. Very good. Exhale. Okay, this time we're going to hold it, right? Same as last time. Big deep breath in and hold it there. That's very good, just hold it. Keep holding it. Okay, you can relax, good. Just gonna put it a little bit further down. Same again. Really big deep breath in and if you can, just hold it. Keep holding it and exhale, good. This time we're going to cough again, so big deep breath in and just a little, just as if you were clearing your throat. Good. And again, one more time down here. And a little cough. Okay. Sounds absolutely fine. Lungs sound nice and clear. Just going to make a little note of that. obstructions. Assuming that you don't smoke. You have very clear sounding lungs if you do. Alright. Good. Now I'm just going to check your heart rate, okay? And I'm going to do this the old-fashioned way, which means I'm just going to feel along your neck here. Once I've got your pulse, I'm going to time 30 seconds, and that should give me a rough BPM. And we're going to do it in a couple of places here and here as well, okay? Now if you could just try and relax while we're doing this, because any excess stress can speed up your heart rate and give a false reading. So just try and breathe nice and slow, and there's your pulse. Alright, ready? Good, doing very well. That's very good. Just keep breathing normally, nice and relaxed. Good. Okay. I'm just going to do one more reading on the neck, okay? Just helps to have a few. Alright. And 3, 2, 1. Keeping that breathing nice and slow and controlled, you're doing very well. Okay, great. It's a very good resting heart rate. It's 68 beats per minute. Just going to clarify and make sure that that's 100% accurate. If you could just put your wrists forward. I'm going to find your pulse and just do it again. And then I'll take an average between all three, okay? Just gives us the most accurate reading. There it is. Don't worry, you're not a vampire. Okay. And same again, just breathing normally and trying to stay calm and relaxed. Do you exercise regularly? Well, we all wish we could exercise more regularly than we do, but it's a pretty good resting heart rate. Okay, about 68, 69, 70 odd. That's very good. Doing very well so far. Alrighty, I'm just going to check your blood pressure now, okay? So if you could just put out your arm and roll up your sleeve. I'm going to put this little strap around it, okay? I'm going to then pump it up. It's going to tighten, hopefully not to the point that it's uncomfortable, and then it's going to take a reading, but it should be quite tight, but again, not to the point that it's painful, okay? Alrighty, pick an arm, either arm, doesn't really matter. Okay. Okay. Just going to strap this here. Ready? Let me know if at any point it gets too tight, okay? About that? Okay, good. Just one moment while it takes a reading. Okay, good. So 130 over 80, which is slightly higher than previously, but I would still say, in a normal range. Any higher though, you know, maybe look at reasons why that might be, but I've seen much worse than that. It's just in comparison to your other readings, it's slightly raised. Okay. Alright, let's quickly just check your temperature if you don't mind. Again, we're going to do this in the relatively old-fashioned way. I've got a thermometer, it's going to go under your tongue, alright? So if you could just open your mouth, lift up your tongue. I'm just going to place this here. It shouldn't take long. Yeah, 36.2, very normal. Alright. Lastly, I think we can just have a little look at the injury area. Anytime people have a head-related injury, it's always best to check over the scalp. If you could just pop your head forward. Okay, I'm just going to be pressing very lightly and passing your hair slightly. If you could just let me know any discomfort, any pain or sharp pain as well, especially. I would expect some sort of dull kind of pain around this area. Did you just pop your head forwards? No prior injuries there, are there? So this is all. I'll post that. Okay. Alright, very good. I'm just going to be pressing slightly around the orbital bone, just on this side. Again, you let me know if there's any severe discomfort. Sorry if it's a little tender, although that is to be expected. No pain around here. And this. Slightly swollen on that side as well, compared with the other side. Yeah, I can see that. And if I press here, on a scale of 1 to 10, sort of 10 being unbearable agony, obviously 1 being barely feel it, what's that about? Okay, so yeah, about a 4, so it's reasonably tender then. Oftentimes when we hurt this part of our cranium, vision can be affected, just ever so slightly. I've got a light here, I'm just going to be shining it around your pupil, so I do apologise. You can just look straight forwards. Yeah, there's quite a lot of redness there actually. Sort of the skin's pulling down a little bit, almost a kind of drooping on the injured side, yeah. Dilation in your eye seems normal. It's just inflammation around the cornea, and I mean, most of your pupil is quite inflamed as well. Doing very good. Alright, just quickly focus here. Don't move your head. Just follow with your eyes. Remember, keep your head still. Good. Okay, do me a favor. If you could just cover the non-affected side. Okay, now just make a little dividing line in the center. Okay. Alright, okay. think lastly we should address that wound. It's important to take good care of it, make sure that it doesn't get infected. So I think we'll just go in the area, clean all around here, make sure there's no gunk in it, and then I'll dress it, put a little dressing on it, make sure it's nice and clean and heals properly, okay? Good. Just put your head down if you can. I'm going to be using some antiseptic cream. This might sting a little bit, but I'm just going to dab around here. Dab very gently and just make sure that the area is looking a lot better. Good. Head down. Yeah, once this is dressed, it should look much better, and I'd imagine this would heal up in about 2 weeks. We'll give you some creams and some special wipes for it. It's important that you are gentle, but make sure to clean it out every day or every couple of days, depending. If it's looking a little bit sore, maybe just go extra gently. Definitely no hard scrubbing. Okay. It's looking better. Okay, good. Doing very well. Yeah, I'm just using a strong numbing and antiseptic cream. Cleans it out, cools it down if it's looking a bit red. Hopefully once the stinging subsides, it'll actually kind of numb the area. Should help it stop bothering you as much. Good, you're doing very well. Good, well done. It's looking better. Good, yes. Yeah, make sure to, it's best to change it in the morning. So, after you've slept on it for a night, obviously, that'll probably be when it's, head's against the pillow, so it tends to disturb it slightly. So yeah, first thing in the morning, get up, give it a good clean, reapply the dressing that we'll give you, and then as it starts to heal up, you can cut back from every morning to every other morning, and then by the 2-week period it should be looking a lot better. Yeah, we'll give you some instructions along with the prescriptive creams, but yeah, just stick with that, you'll be absolutely fine, I'm sure. If it is looking significantly worse, so really red, anything coming out of it, God forbid, then do come back in at once. months, because that probably means it's infected. But if you follow this procedure and try not to disturb it too much, then odds of it getting infected are pretty slim. There we go. That's great. Alright. Just gonna put a bandage. Well, it's more like a small plaster, but a covering on that. Yeah, this will be the one that you change every day. Okay, head forwards. Just gonna press that in there. Okay. A little bit of pressure here. Head down again. Just gonna press on it. Does that feel nice and even? It's nice and stuck down. Okay, good. Okay. Give you the A45 cream for that. Prescription side. Probably only need a 15 milligram tube, maybe 10 even. Yeah, you can take painkillers, ibuprofen, paracetamol, as you have been doing. I wouldn't say anything stronger than that. I also would try and limit it to about 500 milligrams each, maybe up to 800, split between the day if it's really bad, but to be honest, it shouldn't be causing you a load of grief. It'll be sorest for the first few days, obviously, but after that you should see some fast improvement. Okay. So give this to the lady at reception, and she will hopefully sort you out with some creams and some antiseptic wash and some pads just to help clean that every day. Good. Also, I will send over a copy of your updated medical records to your GP. So that's good. It's nice to keep them up to date, obviously. Besides that, is there anything else I can help you with? Great. Fantastic. Well, again, I am sorry for the wait, but that should heal up absolutely fine. Shouldn't leave any marks. Good. Look after it, keep it clean, and I shall hopefully not see you back here soon.